Hello everyone, and welcome to the Pastoral Care class for the Academy of the Synod in Lakes and Prairies. My name is Lisa Watson, and I will be your instructor for these next few weeks. And this is my second time recording this, so I hope that it's going to work, but I'm going to do it slightly different. So this first one is just going to be a brief introduction to me. And then there will be a follow-up video about the course itself, and then another short one about the first session. So we'll try these and see how it goes, and I apologize for the delay in getting this to you. About me. So I grew up Methodist and joined the Presbyterian Church when my husband and I got engaged, and we're looking for a church to join. So I do not have roots in the Presbyterian Church from my birth, but I, since my early 20s, have been in the Presbyterian Church USA. Started out probably with a similar story like you. Got involved in the church, got involved in maybe teaching Sunday school. My husband and I got involved in working with the youth groups, and eventually found ourselves off to seminary. We were married. We had a 15-month-old daughter at the time when we moved to Dubuque, Iowa, to attend the University of Dubuque Theological Seminary. Following our seminary experience, we moved back to the Twin Cities area. My husband got a job in the parish where he still works, and I went on to do some parish associate work while also doing a full-time chaplain residency at Hennepin County Medical Center in Minneapolis, a level 1 trauma and burn center. After my residency experience, I took a full-time position about a year later at Regions Hospital in St. Paul, which is also a level 1 trauma and burn center. And in that position, where I served for the next 18 years, I was the primary chaplain for the surgical intensive care unit, the trauma unit, the physical medicine and rehabilitation unit, also did some work on the mental health units and the neurosciences units. In my work there, I also chaired the patient rights committee for the hospital, as well as served as an ethics consultant for the hospital and trained in the new ethics consultants. I also did some additional training in critical incident stress management and led critical incident debriefings for hospital staff, psychological first aid training, Prepare Enrich, which some of you may or may not have done, advanced directives and healthcare ethics certifications. I also had the opportunity to do a lot of teaching for medical students, residents, nurses, and social workers on death and dying, cultural and religious issues that come up when folks are hospitalized, and taught a lot of psychological first aid training for the hospital staff. Done a lot of work in local churches, leading adult education groups or community or church support groups on grief and loss and living with chronic illness. 5 years ago, I went back to school feeling that I wanted to be able to stay resilient, and continuing more in the hospital setting didn't feel like it was going to be a good fit for me personally, care-wise. And so I went back to school 5 years ago and got a master's degree in marriage and family therapy, and transitioned 2 years ago to working full-time as a marriage and family therapist in a clinic that specializes in working with couples, but also I do about half individuals and half couples, and occasionally some families in my work there. It's been a great transition and opportunity to continue using my work of working with people in crisis in the hospital setting, to being able to work with them in crisis more long-term outside of the hospital as they kind of adjust to the situations in their lives. It's been a great opportunity for me to be able to specialize in working with healthcare professionals as they cope with individual and life transitions, because I also have an understanding of the experiences that they go through in the healthcare world. So that is enough about me. I am going to stop this and hopefully be able to continue recording other sessions.